Hi, I'm Chris Pescatore and I practice in Danville, California. Today I'm going to demonstrate a direct composite technique utilizing the amber shade of premise to place an invisible restoration using its chameleon effect. First thing we're going to do is disinfect the preparation with chlorhexidine. And just rinse it out. It's always important before you start etching, which we're going to do next, that you dry the tooth structure. You don't leave it completely wet. It'll interfere with the etching process. We're going to etch the enamel first. So we're just going to go around the enamel. And then we're going to etch the dentin. And now we're going to rinse. That will be an etch time of approximately, a total etch time of approximately 15 seconds. Now we're going to dry the whole area. Now we will use a desensitizer to re-wet the tooth structure prior to placing our adhesive. Here is our wetting agent, also serving as a desensitizer. Using an air dryer just to lightly blow it dry, leaving the tooth structure moist. You see a slight matte finish to it. That's ideal for placing your adhesive. We're going to turn off the light, and now we will place our Solo Plus. So here we go. We're going to place in, and we're going to just place in the preparation and move it around for about 20 seconds. Okay, after about 20 seconds, I'm just going to take a dry brush and remove some of the excess. And then I'm going to use my air dryer again to evaporate the solvent, which is an alcohol base in Optibond Solo Plus. We're going to use basically two shades, and I use two shades on almost all my direct restorations, and the whole purpose is to just place a restoration that will blend with any tooth structure. The shades I like to use mostly are a very light shade followed by an amber translucent. This is actually an XL1 shade, which is actually a bleach shade. I'm just going to place a little bit of it in the base area, maybe just a little bit right here. After I do this, I will place some small tints. So what I'm doing is, since it's such a small preparation, I'm actually just going to build each cusp or build each ridge at one time. If it was larger than this, I would probably do it in segments. And I'm just kind of smoothing everything down. Just going to put a little more in this area here. And there it is. Now we'll just cure from the top. So I prefer amber because it just tends to impart a slight amber color to the translucency, which tends to blend with tooth structure a little better. And here's where I'll add each cusp individually, or each triangular ridge, and I'll just smooth it. And before I end up curing certain parts, I will put a little bit of tint in here. So here's our first little ridge area on this part of the lingual. Just a little bit. You want to put small segments. If you put too large of an increment, you end up overbuilding the occlusion too much and you end up grinding it a lot of away afterwards. So here's another triangular ridge. If you notice, we created now some nice anatomy. So what I'm going to do to accentuate the anatomy at this point is I'm going to take my Explorer and throw in just a little color, ochre color, or ochre color. Just put a little bit right here, and pull it up. Probably a little too much, so you can always take it out with a little dry brush. You just want a little accent of shade here, not much. Typically patients don't like a lot of color anyway. And so we've already built the occlusion a little bit on the lingual. And I'm also going to add a little bit of amber to this little lingual preparation. Just picks up the color around it and blends beautifully. Now I'm going to add the buccal segments. Just again creating the anatomy as you're making this. It's a lot easier afterwards to just polish this and have it look beautiful than to carve the anatomy with a burr. Plus, carving the anatomy with a burr can always affect the integrity of the restoration. So it's better to create it as you go. And what you could also use, instead of using a hand instrument like that, you can also use something called the compo roller and just roll it along here to smooth out your margins. What I'll do is I'll add both buccal segments and cure it once so you can see that compo roller a little better. Inject a little here. Create my ideal anatomy. Maybe I'll throw in a little tint, just a little on an Explorer. You can use an endo file also. I just tend to use my Explorer. And we're just going to push that together. Compo roller to kind of smooth our margins out. Now I'm just going to fill the buccal pit, and then I'll cure for another 10. I use the compo roller to actually push it in, make sure I don't have any voids. And this is where the beauty of this instrument comes into place, because one swipe and you're kind of done. Very fast clinically. Now I will cure with 2 lights for our final cure. We will put it on 20 seconds, and I'll have 1 light on the buccal and 1 on the lingual, and now we'll re-cure everything. And there you go. There's your restoration. Minimal finishing and polishing. We cleaned the preparation with chlorhexidine, etched it with phosphoric acid. After rinsing that, we placed our desensitizer, and then we lightly dried that, and then we placed Autobahn Solo Plus, placed it for 20 seconds. Then we evaporated the solvent or the alcohol in the system, and we cured it. After curing, we placed a bleach colored material in the bottom portion, followed by an amber translucent, and that will make, using those 2 shades, or even say a B1 underneath the amber translucent, will make the restoration perfectly blend with any color 2 structure. And finished and polished. So one of the keys here, if you notice, the perfect blend with the premise amber translucent is how you really get this to completely blend the total chameleon effect of the restoration. So what I'll do now is take off the rubber dam, check the bite, and any fine tuning. And there you go, there's your final restoration. So there you go, a simplified technique to do any direct composite and have it blend seamlessly.